Yes, good morning, good morning, good morning, good morning, Greg J. Coffee Conversations with Greg J is on. How y'all? You know, excuse me. Hope y'all doing okay. COVID environment, still pandemic. That's where this show was born, in this whole pandemic situation. But, you're listening to the every day, 1 minute they don't have enough vaccines, next minute they do. 1 minute they're declining in cases, the next minute they're spiking. You see the young people down there in Miami on their spring break getting it in, being young and whatnot. No mask. Oh my goodness. What are we going to do? But what an unprecedented time, serious business, right? So today I was just kind of contemplating. I met someone not too long ago, and highly placed executive in the medical field. And as I was doing whatever business that we needed to do with this person, I started thinking, man, their job's been full, And the second thing that I'd like to say is, in Long Beach, I'd like to say this to y'all. We're talking about, racial injustice and equity and all of this. And as I was interacting with this person, who's our special guest today, I began to realize that Black folks run the medical field in Long Beach. Here's why. Remember Dr. Anissa Davis, City of Long Beach Health Officer? I met this brother, Ike Imeje. He's the head of the Long Beach Memorial Hospital. You know that big one up there on Long Beach Boulevard. And I met our guest, sister running the St. Mary's Medical Center. Black folks doing it. I was like, you know what? That's a really beautiful thing. A beautiful, beautiful thing. So without further ado, let's introduce and have some coffee with our new friend, Miss Carolyn Caldwell. She's the CEO of St. Mary's Medical Center. Good morning, Carolyn.
Well, good morning, Greg. How are you this morning?
Doing all right. Making stuff happen. Well, Carolyn, I was reading a little bit about you. You're from Alabama, eh?
Yes, originally from Alabama. I'm sure you can hear it in my accent.
I was saying, I started trying to listen for your accent. That's good. Okay, well, look, tell us a little bit about, how you came from Alabama to the beautiful city of Long Beach, and then we're going to kind of get into what you're experiencing, as a highly respected medical executive.
Sure, absolutely. Thank you. As I said, I grew up in Alabama, and I actually attended college at an HBCU, Alabama A&M, there in Huntsville, Alabama. From there, I moved to Texas in the late 80s, went back to school, got my master's degree in healthcare administration, and been fortunate enough to be an executive in several hospitals in Texas and Missouri. My husband and I moved to Palm Springs, California in 2012. So I ran the hospital there, Desert Regional, for about a little over 4 years, almost 5 years. And then moved to Long Beach in 2017. And it's been a great transition. We love it here. We still have our home in Palm Springs because, we think that's definitely where we're going to retire. But I'm here in Long Beach full time through the week. And on weekends when we have events and things to do. And so we love the city.
That's a beautiful thing. And, congratulations and welcome to Long Beach.
Thank you.
Wow, long way from Alabama. I'm trying to remember the radio station on the campus of Alabama State University, and it escapes me. I know that station very well. Did you ever listen to it when you were attending university there?
I know at Alabama A&M, there was a radio station there, and I don't remember the name, but it was ran by a mother and son that was on campus. It was a great radio station.
All right. Okay. So now here we go. Pandemic happening. I mean, oh my goodness, lots of people getting sick, lots of people, transitioning and all of that. And you're the head of the hospital. What's that been like for you?
You know, Greg, I've always been in healthcare, as I said, going back to the late 80s. And so have been through, a lot of what we thought at the time were healthcare crises. I was actually working in the laboratory when we got hit with HIV and AIDS, and that was a very scary time for all of us. But I will say that with COVID, it's been very, very different because, here we are, it's a year later. Um, I remember last year when COVID first started, we were hearing about this virus. There were some patients in the Northwest, and we were all getting ready, but no one was really getting too alarmed just yet. Because we've dealt with viruses, we've dealt with Ebola, we've dealt with a lot of things, and then it just began to mushroom, and we realized very quickly that this was different. That the way we were going to respond to this had to be very different, and what we were starting to see, we saw it here in Long Beach, and we were seeing it all across the United States, is that this virus was disproportionately impacting minority communities, particularly African American, Latino communities. And it, really not surprising to those of us. I think you probably have heard Dr. Davis talk about this, just because of social determinants of health, access to care, lack of information. And we realized pretty quickly that we had to galvanize, and really the way that we were doing business had to change.
Mhm.
We knew that, we were dealing with something that we hadn't dealt with before. So we had to not only protect and take care of patients, protect our community, but we had to protect and take care of our employees as well. And so a lot of the actions that we had to take very quickly, I was so impressed just with the agility and how quickly the industry was able to come together. And one of the things I love about Long Beach, and I hope we talk about it enough, is that the community came together. All of the hospitals came together. We compete with each other, but it's friendly competition. But this was one time that there was no competition. I mean, if a hospital needed something and another hospital had it, we were there for each other. Dr. Davis, Kelly Copley with the health department, our mayor, I mean, everyone just came together, our FQHCs, to make sure that we were taking care of our patients and in our community.
I was going to ask you, so, do you communicate with the other hospitals like, hey, Ike, listen, I need a few more masks over here. Can you send somebody over?
Yeah, we do, and we've had other situations where, I have Ike and the CEO John on speed dial, and when we need something, we will reach out to them. Not just doing COVID, and they do the same thing for us. I mean, if there's something they need, they know they can reach out to us, and if we have it, we're going to take care of it, because we're all in this community to provide health care for this community, and it's important that we all work together in order to do that.
Mm-hmm. Now, as you look back over the last year, I mean, all over social media, in the news and everything, everybody is commemorating that it's been a year now, since we've been in this pandemic. As you reflect on the last 12 months, what has been, describe for us like the most trying moment for you where you were just like, oh man, where you just really had to reach to your innermost spirit to overcome?
I think the most trying moment for me, I mean, as a hospital CEO, I always say that we have to be in control, right? We can't. I mean, we have to be concerned and cautious, but at the same time, we're the leader, so everyone's looking to us to lead, and they get energy, or they get their directions off of how we engage and how we react. So, if we are showing that we're afraid or we're scared, or guys, this is terrible. They're going to react that way. And so I think probably the most challenging part for me was being that strong leader in the face of a pandemic. Um, I knew that it was more important then than ever that I be visible. And so continuing to make rounds in the hospital, talking to our employees, talking to our physicians, making sure, number one, they had what they needed,
Mhm.
because we heard the horror stories all over the country about hospitals and employees, doctors not having enough PPE, personal protective equipment. That was the one great thing about working for a large organization like Dignity and Common Spirit Health. We never ran out of anything. There were days we may have gotten
Mhm.
low, but we never ran out because they had the ability to move supplies from one hospital to another, to tap into other resources. So I think for me, it was very exhausting because there were days where, I was tired, or maybe, I was concerned, but I felt I couldn't allow my team or our physicians to see that I was afraid as well, because we just had a lot of unanswered questions. And I think some of the most heartbreaking or things was having a physician in my office one day that I really have a lot of respect for. And, because we look to them, we go to our doctors, and
Mhm.
we always look to them to be strong.
Mhm.
And so I closed the door and I said, "How are you doing?" And he said, "This has been tough." He's
Mhm.
married, he has small kids. And he said, "I just have to tell you," he goes, "I've been afraid. I mean, will I get this? Will I take it home to my wife and kids? Will I die?" And he says, "But knowing that we had to come in every day and we had to, take care of patients, and we had to put forth that strength." And when I heard him say that, I thought, wow, these guys, they are hurting, but they're
Mhm.
out there every day. And I think that's something that sometimes communities don't understand, is that individuals in hospitals, yeah, this is what they train for. They they train, most of them, all their lives to be physicians and nurses and other caregivers, but they're human. They have families, they care, they have fears just like everyone else, but they show up every day and they do a great job. And so I think for me, that was the most challenging part, was seeing and knowing the 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 hurt or just the fear they were feeling, and then me having to be really strong for them and be there for them. And I will tell you, there were days that I went home that I was just totally exhausted.
Mhm. Mhm. Leaving it all on the floor there. Yeah,
Yes.
yeah, yeah, yeah. I'd like to ask you a question that's personal in nature for me, because I drive by the St. Mary's all the time ever since I've lived in Long Beach, and I always just kind of wonder. It's not a, with all due respect, it's not a diss at all, but it's just, I'm just curious. It looks empty sometimes. I'm like, what kind of hospital is that? So what? Okay, take away the pandemic. What kind of business are you conducting inside of St. Mary's Medical Center?
It's been busy, and we have a
Mm,
very large campus. It's a 23-acre campus. We have, in addition to the hospital, we have a lot of other clinics on the
mhm,
campus, medical office buildings.
mhm,
I will say that, in the face of the pandemic, the hospital was very full. It was very busy.
mhm,
This hospital, we are getting close to celebrating a 100-year anniversary. It's a 10-story hospital. We only use 7 floors. The top 3 floors were never completed. And
oh,
so now that, when it was built, there was a lot of inpatient business. There were patients stayed in the hospital a lot longer. Things have now moved a lot more to outpatient,
mm,
but it is a very busy hospital. We are a level 2 trauma center,
mm,
and so we take care of, over 50,000 patients every year in our emergency room. We have a women's center. We have a weight loss center, our care program. And so I think, maybe if it looks like it hasn't been busy, it's because the care is taking place in lots of different areas on the campus.
I see. Okay, I was just just wondering. All right, good, good. Okay, so now here we go. You mentioned how you know communities of color have been affected by the pandemic, and when it first hit, we were saying in the community, oh, we're not going to get this, and we found very quickly
Mhm.
that yes, we can get it, and we get it in disproportionately larger numbers. What do you say to the community, like for people who are um, who were skeptical that we would even get the COVID-19? Like,
You
what
know,
did you say back in the day? What did you say to the sisterhood?
right. And so I think we just had the NAACP gala, and that was it was a beautiful celebration. But that was the one thing that Naomi did during the pandemic that I thought was so special because we were talking about wearing masks and social distancing, and doing all the things to try to prevent the disease.
Mhm.
Well, in a lot of communities, there wasn't the ability, to social distance, right? If you were living in multi-family situations, a
Mhm.
lot of the essential workers, individuals that they had to go to work. They couldn't stay home. They didn't have that option. A lot of times, are often individuals in minority communities, and so to have the NAACP actually go to the communities and provide masks, to provide education. And so I think that's some of what was missing, because a lot of times in minority communities, it's really about access, it's about trust. I read an article just this week that, you know, there are individuals called community workers, and there are individuals that actually live in a community that will actually work with, whether it's FQHCs or other organizations, to go inside the community and talk about healthcare, or to talk about disease processes, or to try to educate the community. And that was something that was very critical during this time,
Mhm.
because we can try to get the word out. But I think unless we're actually willing to go into the communities, into the churches, to talk about how serious this is, and that this virus was impacting our community disproportionately to others.
Mhm, mhm, mhm. Okay, so now we're at the vaccination phase, and
Mhm.
I'll be the first to let you know that I am quite skeptical of it, just based on the history of vaccinations in this country. However, I'm resolved to not try to tell people or spread misinformation, tell people what to do. I just will admit that I'm very, very skeptical. But I have invited people like yourself onto coffee conversations. We've had quite a few, and we even have more scheduled in the future, just to provide us with the information so that folks, who may come across this live stream, can make up their own minds. Now, I know you know that we are out here. We're skeptical. We look back on history. Well, shoot, you're from Alabama. You know what it
Right.
is. So,
Very
uh,
aware. Yes.
what um, what say you to the
So
people?
I will say, and Greg, when the vaccine became available,
Hmm.
um, I actually had minority employees come to me, because initially we wanted our employees, our frontline workers, to be the first ones to be offered the vaccine and to have the opportunity to take it. It's
Hmm.
voluntary, right? It's not mandatory. So we still have employees who have elected to not take the vaccine. That's their
Hmm.
decision. But the majority of them have. But I had employees coming to me saying, minority employees, are you going to get the vaccine? Can we
Hmm.
trust the vaccine? And what I told them, my background is science. I have a minor in chemistry. My major was zoology. I've always been in science. And so what I told them, I said, yes, I'm going to get it. And I said, you have to trust the science. And I said, and particularly in our community, where we are being disproportionately impacted by this virus, it is so important that we get the vaccine. And I am so happy that every employee that came to me, they've all gotten the vaccine and they came
Mhm.
back and said, thank you, I got it. But then I realized I need to get it. I need to
Mhm.
get it sooner rather than later. So then I can go back to them and say, hey, guess what? I got it. It was safe. I trust it. But I will tell you,
Mhm.
there is still a lot of skepticism out there. I know there's, because we lived in Texas for 15 years, and there's this senior group of women in Texas, African American, and they were sharing with each other that when you fill out the consent form, don't put your race on there because they will give you a different vaccine. And my
Mhm.
husband shared that with me, and I'm like, that is not true. And I
Mhm.
said, please tell them that. And he said, I will. He says, but they're still probably not going to put it. I said, that's fine.
Mhm.
But that to me just made it so apparent that the fear is real. We can easily just say, oh, take it, it's no big deal. But when people feel that way, and then when we look at the history, um, I was watching a presentation on yesterday about this, and it was a young African American female CEO in Michigan, and she was saying how she feels that she has an obligation to go out, kind of like what I'm doing here, and educate the community. But we have to also acknowledge, unfortunately, some of the things that have happened in the past, where particularly African Americans, have been preyed upon, have not been able to trust the health system. I mean, they went to a system that they trusted, with people that they trusted, and had
Mhm.
things done to them, or they were not given the full information. That really happened, and we have to acknowledge that. But then we have to let people know that this is a safe vaccine and it is going to save lives, and we took it, and we have to advocate for it as well. But we
Mhm.
can't just act like what happened didn't really happen, because it
Mhm.
did.
It happened, sure. American history, that's for sure. That's
Absolutely.
for sure. Wow. Okay. All right. Well, to that I say this. I'll tell you, like I told Dr. Davis. Okay, so we trust you, but we looking at the system kind of side eye.
Right. Yes. And
Yeah.
and that's, but we are here. I mean, we're
Mm.
watching, what's happening, and our teams are the ones that administering the vaccine.
Mm.
And you I really think that we're in a time now where people can trust, what's happening. Are all people righteous and they're going to do the right thing? I mean, we can't say that, but I really think that we are beyond where we
Mm.
were, because I think people ask questions,
Mm.
whereas
Mm.
before, years ago, there was just distrust of the healthcare system, and hospitals and doctors, and people come now, particularly with the internet, they're asking questions.
Mm.
I worked in Dallas, and we used to do a lot of health fairs. We would go into minority communities, churches, malls, and people would ask, they would say, hey, what are you going to do, with my blood? What are you going to do with this paperwork I'm filling out? And we have to be able to answer those questions. And I always tell people, ask questions. If you have a concern about something, ask.
Mm. Mm. Oh, all right, Carolyn Caldwell. Okay. All right. Well, it's so it is so interesting, and it is a strenuous time, and I do encourage everybody to give it a lot of thought. I know I am. I'm just letting you guys know. I think about it every day. What is, you watch people on social media and in the news are getting their vaccination, and it's like, man, should I do this? I don't know. I don't know yet, and that's why I appreciate you and others who come through, and I listen to you very closely. I hear you loud and clear. I just, and it helps me, and I hope it's helping somebody else out here in these here streets. Man, you mentioned your degree in zoology, Lau. Okay, how does that relate to what you're doing now? Like, what did you really like back in the day when you were going to the university? What were you really trying to do? You wanted to work at the zoo?
Not really. I do
Uh-huh.
like animals,
Yeah.
but I'm a medical technologist. So I started out working in the
Oh.
laboratory. And at Alabama A&M, in order to get all of the prerequisites that were required
Mm-hmm.
to, after graduation, I did a year of clinical internship in medical technology. Zoology, with a minor in chemistry, provided all of the prerequisites that were
Mm-hmm.
needed to go for a clinical internship.
Mm-hmm.
But it was a great experience, and I love animals, and so it was wonderful. Then after working in the laboratory for about 13 years, I went back to grad school, and then I moved into administration.
I see. Okay. 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 All right. So now here we are. I saw this comment by Dr. Gloria Willingham Torres. She's talking about the nursing sorority. Actually used St. Mary's venue to provide community education several years ago. They hope to restart these programs in partnership with St. Mary's after the pandemic. St. Mary's is ideally located to reach vulnerable communities. And this brings up a question I'd like to ask you. You know, I was talking to the new councilwoman, Suli Sorrow, and they were talking about the vaccination centers were not readily accessible to to their community, particularly for the seniors. And on the other hand, at the same time, I was hearing how Long Beach was pretty much become like the standard for municipalities responding and deploying the vaccinations, you know, across their area. What makes Long Beach so good at it? And then, you know, how have you responded to helping people have access to vaccines?
I think what has made Long Beach really good at it is that we have our own health department. So that I think took out a lot of the red tape per se. You know, we work with the county, but because we have our own health department led by Kelly Copley and then with Dr. Davis. So I think because of that, the city of Long Beach was able to move a little quicker.
Mm-hmm.
Here at the hospital, we vaccinated initially all of our high risk employees and physicians that were those frontline workers. We followed the guidance of the Long Beach Health Department as well as the CDC. And then we opened it up to individuals within physicians' offices. So those individuals, and then we vaccinated people working in our office practices here on campus. Then, when the vaccine became available for individuals 65 and older, we opened it up for our employees to bring in two family members that were 65 and older, as well as our physicians. We allowed this to happen as well. And that has been a huge morale booster. It went over very well because even though we have the mega vaccine locations, we have them here in Long Beach, we have them in other parts of LA County, to be able to, you know, come to the hospital, come to our vaccine clinic that's definitely smaller, and then to have, you know, your son or daughter with you. That was very heartwarming to see our employees have that opportunity to bring their family members. We have a mobile unit, and so we have offered to the city, and I know they're working at going out into communities, and we've told them that, you know, we have a mobile unit. We can make it available if there's something that they would like to do. I know they've also ran some clinics on weekends in some of the senior communities, and because you have to go into the community, we have to make it easy, right? We can say, okay, everyone come get vaccinated,
Mm-hmm.
but if we don't make it easy for them to have access to the vaccine, it's not going to work.
Mm-hmm. 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 Wow, that's a good work, good work, good work. Okay, so here's an abstract question for you. You know, you mentioned that you have weight loss center on campus there, and I've been the last couple of days been talking about this COVID weight that we've gained, being safer at home and just eating everything in sight. And I guess they're calling it the COVID-20 now. You got to try to lose that, those 20 pounds of average that people have gained in this day and time. So to me, it sounds like you're about to have a increase in that particular sector of your portfolio. We need to get to over there to St. Mary's and learn how to lose weight. But seriously speaking, certainly weight gain contributes to diabetes, high blood pressure, and all of that. Do you see increased cases of that? And if so, what are some of the things that people can do to mitigate those increases of dangerous healthcare?
And unfortunately, and I did a lot of actually did my thesis on this in grad school, but did a lot of work in the Dallas community when I lived there, and we see it here in a lot of our minority communities. There tends to be more struggles with hypertension, more struggles with obesity, high cholesterol, and different things. And so we really try to talk about prevention, and just when we say, know your numbers. And once again, just going back to access, the one thing that the Affordable Healthcare did is that it gave individuals who maybe in the past didn't have health insurance, it gave them the ability to have health insurance so that they could have access. But what I think a lot of us didn't realize at the time, and I remember this was 2010, because we were like, well, why are people still coming to the emergency room? Well, just because they had Medi-Cal, because most that was what was done for a lot of individuals who before couldn't afford health care. They expanded Medi-Cal. A lot of providers didn't take Medi-Cal, or people still didn't know where they could go to receive that care. So we realized we had to do even more education, right, to get people in for their care. But it's really all about access. It's about education, just trying to be more active. I know even if we talk about that COVID weight, I mean, we worked through it the whole time, but you're snacking, I definitely did a lot more cooking at home when we couldn't go out. So I just try to walk more, in the hospital, count my steps, and trying to make healthier choices.
All right, that's what's up. Now, okay, so now we're out there working out and running. I know I run, especially along the shoreline regularly, but after I get to a certain pace, I need to take my mask off. Am I still safe?
hmm I as more and more people are getting vaccinated, because when I'm in the desert, we hike. And so, when my husband always says, I can't breathe with this mask on. Well, when you're hiking, there's no one else around. I mean, you're in the mountains, you're hiking. I keep my mask on. I don't have an issue with it. But what he will do if he approaches someone, then he will, put his mask on.
Mm-hmm.
Um,
Okay, that's good. Now, what is the best mask? Because I've been hearing lately now that people are starting to get this COVID fatigue, right? And one of the
right.
main complaints right now is just the doggone mask. And some people are saying that the N95, the surgeon one, it something is causing them, difficulty to breathe now that they're having to wear it almost every day. Others are saying, you need to have double mask. Others are saying that these all the the ones where folks want to be cute, our designer masks are affecting their breathing and everything like that. What's the best mask to have? And doggone it, when can we get rid of them?
And I go back to, I mean, we continue to follow the CDC guidelines. And I know people get frustrated because it changes, right? I mean, we go from the three-ply mask to the KN95 to double mask to now we don't have to double mask anymore. And so just continue to follow the CDC guidelines, because the more people get vaccinated, the closer we get to having, herd immunity. But I think as long as there's still that population that's not vaccinated, we will still need to continue to wear a mask to protect others. And I think because the last thing we got, and I think it's just changed a couple of weeks ago, because we were double masking, But now it's, well, wear the 3-ply mask or the KN95.
Mhm.
Um, and but I think the main thing is just making sure that we wear the mask.
Mhm.
Um, I've noticed like in town, you starting to see more and more people maybe not with the mask on. It's like, oh, put the mask back on so
Mhm.
we can
Mhm.
get out of this sooner. I know it's uncomfortable. We've not seen our grandkids since the middle of 2019. So we hope to
Mhm.
be able they're in Atlanta. We hope to
Mhm.
be able to go see them soon. And I told my granddaughters are 3 and 5, and the youngest one doesn't like to wear a mask. And I said, well, you let her know that when grandmommy comes, if we go anywhere, she's got to wear a mask.
Got to wear the mask.
Because it's not comfortable.
Mhm.
It's not fun. But I think the more we continue to comply and follow the CDC guidelines, the sooner, hopefully, we'll be able to get back to normal.
Well, I'm just going to be a snitch right here because there are certain communities that are seeing the having to wear the mask as a political statement, as a sign of oppression, have
Hmm.
even gone out into the streets, to protest against the mask and everything. But I know that if I drive into certain neighborhoods of Long Beach, nobody's wearing the mask because they don't feel like they have to. What would you say to those communities?
I would just encourage them to please wear their mask.
Mm,
And another thing too is that when I spoke about healthcare, we're
mm,
here to take care of everyone.
mm,
Our teams are here, our physicians, our doctors are here, and so what we were saying is that when people get sick, they're gonna end up in the hospital.
mm,
And when COVID was so bad, you saw a lot of messages about, be safe, wear your mask, take care of yourself, do it for us, right? Because it was a very scary time. And so I will say that as well, is that, let's just, I know people have fatigue, but let's all continue to work together, continue to practice, the safety guidelines, and to wear a mask so that the sooner we can all get back to some sense of normal.
So wear a mask, social distance,
Wash your
wash
hands.
your hands. It's like, well, man, Mama used to tell you that. Yeah.
Yes, absolutely. See,
Yes,
that
yes,
one was easy for me, being
yeah.
someone in the sciences. So I
Hmm.
always had my little hand sanitizers already before before any of this started.
Right, right, right. All right. So now cities across the nation slowly reopening, some faster than others. Schools are reopening across the county, and I don't know about other areas across the country, but certainly LA County starting to, the school system says, okay, you can have in person learning, but the teachers are like, no, not so fast. Are we moving too fast towards opening?
I think that as more people are getting vaccinated, and I was very, very happy to see that, teachers are getting vaccinated, because I think if we're going to say we want the schools to open, then we need to make sure we're protecting our teachers, right? And we're putting things in place to protect them. Um, I think that the reopening, from what I can tell, now some states have just said, we're just opening. We
Right.
don't care. Everything's open. I think that's wrong. But I really think the way that we're doing it in California, LA County, it's very graduated, right? It's,
Mm-hmm.
we had the outdoor dining, and then it's like 25%. Schools, and with a lot of the restrictions. And so I think it's being done very thoughtfully, because at the same time, even though we've had to close and pull back for public safety, um, we can't stay closed forever. And as
Mm-hmm.
far as kids are concerned, my husband and I both said that, we're glad our kids are adults and then we're not having to deal with this. But I'm sure it's very challenging for families with young kids. I'm sure it's very challenging for the kids, because kids need to socialize. I mean, that's part of learning as well. And so I think as we do open up, it's as we do it gradually and thoughtfully and follow all the guidelines.
Yeah, I think it's difficult for the children just trying to learn through the computer monitor. And I was asking my grandsons about they're seniors in high school, and I'm like, well, what about your new friends and everything? There's no there's no interaction among the students. And then as we look forward in a couple of months, there's no prom.
Right.
Football season was messed up. I mean, it's just really they're missing the essence of that high school experience. And it's just a really really bad. And I hope that they remain thoughtful, but at the same time, my thoughts go out to class of 2020 and 2021. They didn't get to have the fun that you would have as a senior in high school. That's really really something. Okay, so now with your now that we're in this reopening piece, what is the hospital's role in helping that? I mean, do they consult you? Do the authorities call you up and say, hey, Carolyn, what do you think? And you get your doctors together and you guys have your brain trust and you say, well, look, Mayor, I don't think you should open, or whatever the conversation is. Do you have
So
a mhm.
yeah, so what we do, I mean, we meet every day, sometimes several times a day, and so we're going to always follow um, our CDC guidelines, our
Mhm.
state and county guidelines, and so we had to in the height of COVID, we stopped doing elective procedures. And really cut back. We didn't have visitations. Some of our students, we were talking about students, we didn't think it was safe to have students. A lot of the reasons why hospitals cut back on elective procedures was to preserve our PPE and also to cut back on unnecessary exposure. Well, now we are gradually opening up. We've reopened for elective procedures. We're bringing some of the students back to the facility as well. And so we are just making sure that we're following all the guidelines as far as social distancing. Even in our cafeteria, we closed the inside dining, and so our employees were having to get their food and go back to their area. And so once the city said 25%, indoor dining, so we open up our inside cafeteria, but with spacing, it's not like full capacity. So we
Mhm.
just continue to follow those guidelines as well.
Mhm.
And
Mhm.
we have been on calls, particularly in the height of the pandemic. The mayor would pull calls together with all the leaders, the healthcare leaders in the community, and get our input
Mhm.
as we were going through this together.
Fascinating stuff. Let's change lanes a little bit to focus globally. We are based here in Long Beach, and we are proud of our residents here, but we are really global in scope, and that means we are really about the business of building bridges of music, arts, and culture and information with the continent of Africa. And your name has come up actually a few times as we've tried to arrange trips over to the continent, and having, wanting to see if you would be interested in intersecting with medical professionals over in Kenya, over in South Africa, just having this dialogue of exchange and everything. Do you ever, link up with medical professionals across the world, particularly in Africa, and like, do is there a flow of information that you would like to see to help our brothers and sisters on the continent to deal with this COVID environment and other, maladies in a more better way?
I've not directly, but indirectly, just through a lot of my organizations.
Mm-hmm.
Definitely. I mean, we hear about and we know, what's happening globally because, we are so connected, right? I mean, when we think about, COVID and some of the other diseases, and now as we're looking at, the variants that are coming into the United States, I think we have to be connected globally. So indirectly, yes, just through a lot of journals and through a lot of the healthcare organizations, definitely we have to know what's happening, really throughout the world, actually.
Mm-hmm. Mhm. It's interesting as we chat about vaccines and all of the things that your great hospital is doing, and we talk about Mother Africa there over in Tanzania. When the vaccine started rolling out, the president of Tanzania says, "Okay, we're not going to have vaccines. We're going to rely on natural remedies." What do you say about that?
Wow. Well, I'm a scientist, and so for me, it is. I was all about, we've got to get this vaccine, and we've got to get the vaccine into arms as
Mhm.
quick as possible, so we can get back to normal. And that's what we always tell people is, you see so much on television and social media, um, but there are some really smart scientists out there, and we really need to believe the science.
That's interesting because some people, when I've had people from Africa on, highly educated, and I ask them that very same question, and they always go back to, you know what, though? There is always healing in the earth.
Yes.
Yeah. Wow. 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 That's really great. Carolyn Caldwell, I really enjoyed this conversation with you this morning. And it's Women's History Month, and we frame this as identifying you as one of our phenomenal women of the month, and we just really, really are proud of the work that you're doing. Proud to hear your voice in this whole thing, and we'd like to just say, you are welcome to come on Coffee Conversations anytime, and let's just keep close and chat it up. We're always about health. We need health is wealth, right? And we need our health before we're able to do anything else. Are there any parting shots you'd like to say to the people? Anything you need for the people to hear you say while you're on Coffee Conversations with Greg J?
Well, Greg, first of all, thank you for inviting me to come on, because especially now, I think it's so important that our voices are heard. And I would just like for the community to know that as leaders, whether you're leading a hospital or other organization in a city, it's important that we step forward, that our voices are heard. I think we have a moral obligation to be connected with our communities and make sure that we're doing everything we can for the well-being of our community.
Mm-hmm, mm-hmm. All right. And then you're saying get the vaccination. That's what you say.
Yes.
All right, Carolyn Caldwell. All right. Wow, really good, really good. Well, you know what? There it is, y'all. St. Mary's Medical Center. You know where it is. If you're in Long Beach, big old place, man. She said 23 acres. I didn't realize it was that many. It is a big campus over there, and it's there's a lot going on in there. So she says, and they're really handling. They're doing a doggone thing as they handle this pandemic, and you see it. Just look, black girl magic running the hospital. That's the good stuff. All right, all right. Thank you so much for coming on, y'all. Listen, this is Coffee Conversations with Greg J. You can see if you missed this live stream, you can go to Beach City Radio, beachcityradio.com. That's our online radio station. It'll be on demand there. It'll be across all of our different Facebook pages. And then also now, we just did release this a couple of weeks ago. You can get the audio only version as a podcast wherever you get your podcast, iHeart, Apple, Spreaker, Stitcher, you name it. It's there. Just Google Coffee Conversations with Greg J. If you want to support independent media, you can Cash App us. You can PayPal us. You can just hit us up by email and let us know that you'd like to support. Let me just put that information up there for you so you can do it if that's what you're so inclined to do. We are just here to build bridges of music, arts, and culture all across the world. This is relevant, culturally relevant conversation. You know how we do it. Next week, we're going to talk about HBCUs. I know we got Dr. Teresa Price coming. She's got the Black College Expo, been doing that for years and getting our young people into the HBCUs, finding financial aid, all of the things that you need to get your young person into higher education. inside of the HBCU. Carolyn Caldwell's from an HBCU. Look at
Yes.
that. That's all right. Look, this is a beautiful, beautiful thing. We got to do it. All right, y'all. All right. I think I've said everything. March 30th, Arts Council for Long Beach, State of the Arts, will be streaming on platforms all across your digital devices, Facebook, on their website, artslb.org, Beach City Radio, dreamcreator.org. We're just doing everything that we can to inform you and inspire you. Yeah. All right. Love one another. Love one another. Love one another. Peace and blessings.